Hi guys, this is Jackline once more, your midwife, and I'm happy to continue the series on family planning. I hope you're enjoying the series, and the reason we are doing this is because we want to reduce the unmet needs of family planning, especially which are brought forth by misconceptions, lack of knowledge, and fear and all that. So we want to really support reproductive health and especially meeting the demands of family planning. So my colleagues and I have brought forth some other methods before, and today I want to discuss methods of family planning used for emergency contraception. So this has been a method that people really use, and today we want to discuss about the methods that we want to use that one can use for emergency contraception. How safe are they and how effective they are? So first, to define emergency contraception. Emergency contraception is the use of contraceptives to prevent pregnancy after unwanted sexual intercourse or sexual activity. So these methods are used to prevent pregnancy on someone who already has had an unwanted or unplanned sexual activity and would want to prevent pregnancy. These methods of emergency contraception, we'll talk about 5 of them. Their main mode of action is usually to prevent ovulation, also to prevent mobility of the sperm or the ovum through the fallopian tube, because fertilization takes place at the fallopian tubes. So these methods will help to delay or even prevent the movement and the meeting of the sperm and the ovum. So this means there won't be conception. These methods are effective, highly effective, but they are rated at around 75% to around 95% effectiveness. The method depends on when you take it, because they have a timeline, and most of them require you to act within 120 hours after unprotected sexual intercourse. So we want to see these methods and see their advantages and disadvantages. The advantage of all of these methods is that they will protect one against unwanted pregnancy after unplanned or unwanted sexual intercourse. Secondly, these methods are what a health worker will use for post-rape care, because post-rape, nobody wants to conceive from rape. It is not right, and of course most people would not want conception related to rape cases. So it is part of post-rape care to prevent conception. So this is a great advantage. Another advantage is that these methods will also prevent the complications that come from unwanted pregnancy. And these complications include there could be neglect of children due to maybe unwanted children and all that. There could also be abandonment of the children. Also, unwanted abortion or unsafe abortions, because many people or some people could run to unsafe abortions. These methods will also at least protect from financial constraints and all that. So they are methods that prevent complications, including deaths, because a mother could be not wanting pregnancy, maybe shortly after delivering another baby, or maybe you have a scar that requires you to take time before conceiving. So these methods can be used, and they are safe, but we shall see any limitations that may come in. So now we want to get into the basics and describe each method that can be used for emergency contraception. Number 1, we have progesterone only pill that is made specifically for emergency contraception. The progesterone only pill is usually made of 750 UCGs, and this pill is used within 120 hours of unprotected sexual intercourse. So you take one pill as soon as possible after unwanted or unplanned sexual intercourse. So as long as it is within 120 hours. And then you take the next pill 12 hours after. Remember, if you want to continue with contraception, that is a hormonal like the progesterone only pills, you can start them and continue from there. So the progesterone only pill is safe, and so you may need to use it. But remember, this is a very high dose, because the alternative of using this progesterone only pill is taking the normal pill, the progesterone only pill. Remember the normal mini pill that we talked about for family planning. You can use that pill, whereby you will do 20 tablets at once. You take 20 tablets at once, still within the 120 hours after unprotected sexual intercourse. Then after 12 hours, again, you take another 20 tablets. So this is what can be able to equal the emergency contraceptive. So that means if you're using the normal mini pill, you will use a total of 40 tablets to achieve emergency contraception. The effectiveness of the progesterone only pill for emergency contraception is quite high at around 95%, but this must be accompanied by adherence to timelines. So you use it within 120 hours. And of course, we know that 120 hours is given, but as soon as possible. If possible, 1 hour, 2 hours, 3 hours, at least use it early. Also, on the progesterone only pill, you can still choose to take 2 tablets of the 750 mcgs. You take 2 of them at once and do not repeat after 12 hours. So this is an option. So you can either use 1 tablet and then use another tablet after 12 hours of taking the first tablet, that is the 750 UCG, or take 2 tablets of 750 UCGs and do not take again, but still within 120 hours after unprotected sexual intercourse. This is the progesterone only pill. The next method that you can use for emergency contraception is the combined oral contraceptive, or the combined oral pill. So this pill has a dosage of the normal pill, the low dose pill, 30 mcg. So you can use the 30 mcg pill, take it immediately, take 4 tablets immediately, all within 120 hours of unprotected sexual intercourse. You take 4 pills and then you repeat another 4 pills after 12 hours. So this means you will take it still in 2 phases. The next thing that you will do, there can be the high dose pill, the one with 50 mgs. So this pill with 50 mcgs, you shall use 2 pills of 50 mcgs within 120 hours or as soon as possible after unprotected sexual intercourse. And then you take another 2 pills after 12 hours of taking the first pill. So this means you will need a total of 4 pills. With the low dose pill, the one with 30 mcgs, you will use a total of 8 pills. But with the high dose, this 50 mcgs, you will use a total of 4 pills. So this is all about the combined contraceptive. But the combined oral pill is known to be a bit lower in terms of effectiveness than the progesterone only, because its effectiveness is at around 75%. So this is all about the combined pill. The next method that we are going to look at is a method called the UPPA, the uripristal acetate, or the UPPA. So this method is a new method that works by suppressing ovulation or delaying ovulation. This method, you use a tablet that is of 30 milligrams once, and you are done, but still within 120 hours after unprotected sexual intercourse. So another method that we have is the copper intrauterine device. So a copper intrauterine device can be used as an emergency contraceptive and is very suitable for someone who is planning to continue with the copper intrauterine device as their method of family planning. So the copper intrauterine device can be effective as an emergency contraception if it is inserted within 5 days after unprotected sexual activity. So this method should be inserted as soon as possible, but after 5 days, it could not be effective as an emergency contraceptive. Remember, our goal is to prevent pregnancy before it occurs. We are not doing an abortion, we are preventing pregnancy. It is important to note that these methods of emergency contraception, they are not regular family planning method, apart from the intrauterine, the copper device, which can be used as a normal family planning method. And the reasons for not using them as your family planning method of choice is because, number one, the effectiveness could be quite tampered with, and number two is because of the high hormonal doses. So as we can see, like the progesterone only pill, you're taking like a total of 20 tablets. So imagine taking 20 tablets, 40 tablets this week, 40 tablets next week. That is, high hormonal surges could not be good for you. So it is important to plan on a reliable method of family planning if at all you're planning to continue with any sexual activities. So these are the methods of emergency contraception. We can talk about their disadvantages. Disadvantages of this method, as we have said, number one, you must take them within the time that has been given, timelines. So we are talking of 120 hours. If you take them later, remember the effectiveness is highly reduced. So these methods depend on timelines. The next disadvantage is that they cannot be used as regular family planning methods. Another disadvantage of these methods, none of them protect you against sexually transmitted infections. So it is important to use backup methods when you are at risk of sexually transmitted infections, or seek treatment for any partner who could be having the sexually transmitted infections, including HIV. So something else with these methods, maybe you could have a few side effects like maybe vomiting, nausea and vomiting. So when these effects come, it is important maybe to seek some help. But if they are not major, maybe like if one vomits after taking the pills, within 2 hours, remember you may have to take another set of pills. So you realize if you vomit the pills within 2 hours after taking the pills, you may have to replace the pill by taking another set of pills. Remember, if you vomit too much, it is good to seek some medical advice from your healthcare provider. It is also important to confirm from your healthcare provider if you have some underlying conditions. That is a chronic condition such as hypertension, heart issues, any issue that could be bothering you. It is important to consult also the healthcare provider to confirm the eligibility or how eligible you are. Another thing that we need to know is that the methods cannot be used if one is already pregnant. So we are not maybe terminating pregnancy, it is to prevent pregnancy. So these methods are only used for someone who is not already pregnant. Some of the great things that we could find from these methods, they can be used and then you start and continue with another method of family planning. So this is all about emergency contraceptions. If you have any question, always ask, keep following, and enjoy the series. Thank you so much. Bye.